Thank you and welcome to the show. The topic this morning is the Metropolitan Public Health Department, and we're fortunate to have with us the director of the Metropolitan Health Department, Dr. Stephanie Bailey. And Dr. Bailey, let me welcome you to the show this morning.
Thank you.
Dr. Bailey, you know, I think that we've had an opportunity to talk to you as a public health official prior to this time. And I think that at that time you gave us some information about your background and your education and some of the other things that were important in leading you to that particular position at that time. But now, as the director of the Metropolitan Public Health Department, let's have you to give us some information about your background, some of the things that were important in your education, and the things that were significant in leading you to the directorship of the Metropolitan Public Health Department.
As far as background and education is concerned, I went the normal academic route of, high school and college and medical school. And I didn't think about public health as a career, I guess, until I was thrown into it. From my residency in internal medicine, I went to fulfill my obligation as a National Health Service Corps recipient during my medical school career, and didn't know that was public health at the time. You know, I was a practicing physician in a rural counties of Tennessee. And from there I came into public health, and I've been in public health about 15 years. So my preparation as far as thinking when I was little that I'm going to be a public health official was not there. And once I sort of began to feel the culture of public health, what it's all about, what the mission and its purpose is, then my realization of this is where I need to be, and this is where I want to be, and this is where my talents are best suited. People-oriented, a good listener, having patience, wanting to see outcomes and results. And whereas I could help maybe 50 patients in a day in a private office, I get the opportunity to affect the lives of hundreds of thousands of people that come through the health department. That's in Davidson County, 500,000 people plus. And my previous boss was the one who put that in perspective for me. And sort of said to me that, yes, you could see patients on an individual basis, but you do get to affect the lives of so many people, and monitoring the health status and making the whole community healthier. And that's a challenge, and one that I welcome very, very readily.
Very good. You know, when we talk about the Metropolitan Public Health Department, exactly what are we talking about when you talk about the delivery of health services to the public in metropolitan Nashville? What are some of the facilities, and how is that service delivered from your perspective?
Let me start by saying that a lot of people feel that or forget that public health means the health of the public. And it involves engaging the whole public, the whole community, in accepting responsibility for its health. And public health is seen as a facilitator of that. We were fortunate several years ago to be able to extend our physical facilities to at least 8 areas of Davidson County. So we presently have 9 facilities out of which we administer public health services. We got into primary care delivery of services. Ostensibly, there should have been enough healthcare providers in the city to do primary care services, but you still had indigent persons, you still had people that were made a little bit of money, not quite enough money. And as our quality grew in primary care, you had those persons who just wanted to come to the health department to get their services. So we have been providers of services from primary care, personal health care services, to health promotion and health protection type services. We monitor your food, your water, your air. We do well child delivery services, monitoring the health status, of course, sexually transmitted diseases and communicable diseases of all sorts come through our facilities. We're collectors of data. Vital records is very important. Environmental health protection, whether it's swimming pools, restaurants, um, lots, sewage, or noise, or odors, or that's our domain. So we come to deliver a lot of services, and not all of them are considered to be traditional public health services, which is where we find ourselves now transitioning back to because of managed care and TennCare, which has sort of taken over, and rightfully so, the management of primary health care services.
When you look at the Nashville area and the area in which you administer service, what are some of the important health questions that you find in Nashville? And in a sense, are these health questions any different from health questions in other areas? Are there anything that might be peculiar to health dealing with Nashville?
Nashville is, not unsurprisingly, like any major metropolitan area. We may be slower, our numbers may not be as high, say, as New York City or Boston or Raleigh or whatever, but we have the same sort of problems as any major metropolitan area today that is besieged by poverty and drug usage and teenage pregnancy. The areas of violence, the areas of chronic injury, injury prevention, chronic diseases, infectious diseases, all of those are issues that plague major metropolitan areas. So we're no different than that. It's just that our numbers are not quite as astronomical, but they are increasing.
Let's look at some of the programs that are administered by the Metropolitan Public Health Department. I think earlier we talked about your Shots for Tots program. And let's talk about that between now and the first commercial break that we have, and then we'll talk about some of the other issues after that. That's
one of many programs that fall under our maternal and infant health division. Shots for Tots is an emphasis that sort of started, well, immunizations, getting 24-month-old children immunized was a goal and emphasis of our health department that started, I guess, about 4 years ago. And we have a very active coalition that's made up of community membership that engages in and plans activities to get our shots up to where the national goal is supposed to be. We were at about 60% immunized about 4 years ago, and the national goal was 90% by the year 2000. Well, we reached that goal this year, and we're very proud of that.
So you're ahead of the schedule in terms of reaching that goal.
Absolutely, absolutely. Other programs within that are our HUG program and our community case management program, Healthy Start. These are all case management programs that actually finds first-time moms, babies from newborn infants from dysfunctional families or single mother homes that may have a little bit of trouble networking with the resources that are in our city. So we case manage them, means we go out and we find out what are all the problems in this family, what are the risks for not succeeding in this family, and then we try to find them resources that will address these needs, whether they're medical, whether they're social, physical, whatever. So that's been a very good program. As we move back into the community, we're going to actually go back into the community and out of our physical facilities.
You know, and we'll talk about moving back into the community after our first commercial break here, Dr. Bailey. We'll be back with you following this first commercial break, and at that time we will talk about some of the other things that we've talked about and perhaps review some of the things. We'll be back with you following this commercial break.